Welcome everyone to Perfectly Healthy episode 11. No, episode session 4, episode 11. I have to remind myself. Thank you guys all for taking the time out this evening. We're going to be introducing a special person. I've known Colleen for a long time, so I want you guys to get to know her because she is our new doctor on staff. So I'm just going to go, some of you will know who I am. You know, I host the Perfectly Healthy show once a month. And so again, our intent is to give you guys information so that you can stay abreast of what is new, what is happening, and how to create a lifestyle of vitality and also well-being. So I'll go ahead and talk a little bit about myself. For those who don't know me, I've been working with Dr. Keneally for the past 24 years. I wear several hats here. One of them is going to be working with our patient for lifestyle modifications. So depending on the condition and the labs and the doctor's requests, then I will meet the patient where those needs need to be met. My goal is not to change anybody's philosophy, but to get them to look at it from a scientific point of view in regards of how we can accommodate by making a lot of swap outs when it comes to their diet, but also letting them know that their body and mind are not separate. And so looking at them as a whole person, whether it is exercise, movement for circulation, whether it is sleep, whether it's breath work, getting enough oxygen, and also dealing with their emotions. So I get the privilege to work with a lot of our patients that, you know, are dealing with a very vulnerable state of health, precisely cancer and immunity issues. And so with that in mind, you know, I really want them to understand that healing takes place from, you know, top to bottom, not just the condition in and of itself. Plato said something really profound, and I thought it was great because it kind of looks at the allopathic way of treating patients. He said the cure of many diseases is unknown by physicians because they are ignorant of the whole. For the part can never be well unless the whole is well. And so that's what we do at the Center for New Medicine. We do integrative medicine here, where we look at you not just with what the symptoms is or what the disease is, but how you acquired this. And so we look at the roots of where it came from. So again, I do the EVOX, which is an emotional work. I work with patients, you know, with metabolic disorders. And also, of course, you know, not everybody, but many women my age are always looking to get that little menopausal pooch off or to try to maintain their youth as much as possible. So again, those are some of my expertise. So I'm going to go ahead and introduce Colleen. Colleen and I have known each other for quite a while now. And what I love about Colleen is that she's very vast with her knowledge. And, you know, she didn't start, you know, when she was, you know, a teenager going to school. She really started when she was a youth. Her parents were very much into integrative medicine. I think that you had told me you were like the youngest child that ever had gone through the civil mind control, which is a method of really working with the mind at the age of 10 years old. So imagine having parents like that are already coaching you into the mindset of recognizing that body and mind are not separate. They are integrated with each other. So I'm going to go ahead and let you, Colleen, kind of give a little bit of background on yourself. So this is Colleen Galvin. So we welcome her into our clinic. She also deals with a very delicate population in regards of our patients that have cancer and healing immunity issues on the healing side as well. So you want to kind of share a little bit?
Sure. Thanks for posting all that. I can't remember all these schools I've been to and places I've been. And we certainly could not take care of the healing patients without you and EVOX and the emotional underpinning of what gets all of us in trouble these days, no matter if it's autoimmune or it's a cancer or just depression. We really need you here at this clinic. So patients are really very, very pleased to work with you. Without extending it, yes, at 10, I was the youngest graduate of Silva Mind Control, where we, over time through the program, we actually entered into people's bodies at a distance. So of course, you go into your own workshop in your mind and try and help them. So I think I was born into this in this lifetime, that I was going to be a healer from a young age. I also grew up with a mother in chronic pain who had her back opened up from the base of her neck to the base of her spine back in the day for multiple disc problems. And so when I grew up, she always had weights hanging over off the bed with a girdle to give her back some traction. And I would massage her and jumped right into the role of the little helper. Went on from there. Undergraduate degree in Latin American Studies, Portuguese, and Spanish. So I have a wonderful understanding of Latin America and other cultures and the herbal traditions and so forth from other cultures. Went to school in Brazil, pursuing a master's in public health. Then I went to acupuncture school. Then I went to the University of Osteopathic Medicine and became one of the first osteopathic PAs. Was the first and only PA school that was at an osteopathic school, which I was thrilled about because I did all of my electives in osteopathy and full body adjustments. And after that, I certified as a naturopath, state of Nevada, mainly to make sure that I could practice homeopathy here in California, which was kind of outlawed back in the day. And then I went on to get my doctorate in Oriental medicine and Chinese pharmacology. 30 years of experience from family practice to orthopedics, plastic surgery in the mid-2000s, where I worked with it was an all-female group. We worked with cancer patients, mainly doing tram flaps and helping women with reconstruction after breast cancer. And a whole host of other kinds of experience, got into stem cells, back into orthopedic, sports medicine, and then oncology, both in San Francisco and now here, because it is just, as we're going to go on and talk about, become epidemic in 2025. And so it's really pertinent that we address that and address some of your all's concerns. I've seen some of the questions here.
And so one of the things that you become an expert on is low-dose chemotherapy.
Right.
And of course, it's a bit different than full-dose chemotherapy, so we're going to be talking about that a lot this evening as well. So hopefully we'll answer some of your questions. So I think I'm going to go ahead and go to the next slide. So again, if you're not familiar with us, we are in Orange County. This is beautiful Orange County, where we have lots of beautiful sunshiny days. Today we have kind of a cloudy day, so we welcome that nicely, so we can move into the holidays with a little bit of coziness. And so again, when you come to our clinic, it's like coming to a home. It's not like your typical sterile clinic. It looks like you've walked into a place where you actually feel safe and comfortable. And that's the way we want to treat you. We want to treat you as if you are now part of our family. We all work together integratively. So, the doctors all meet, once a week. They discuss the patients, their needs. They get, again, different eyes allows for a more comprehensive treatment plan. And then, we have so many modalities here under one roof, which makes it really nice, whether it is, any of the frequency equipment that we have here, which, are what I call the technology of the future, because, we are frequency based. And so we are an electrical current. And so, a lot of our machines you won't find in other clinics because it isn't what we would call standard protocol. And so whether they're hyperbaric chambers or they're oxygen baths or they're, IVs that are very specific, or, any kind of immune therapy that we use here for prevention, And so we have a lot of different treatments. So again, you can check us out on our website. We've got a whole menu of some of the things that we do here and what we're well known for. So again, just a little bit, we're very close to a mall, so you can go there and not only just shop, but we've got, really nice restaurants there that also have farm to table food, so that you can be assured that you're going to be eating healthy when you come here as well. So worrisome statistics. And so as Colleen mentioned, we are in an epidemic in regards to the rise of cancer. I think, in the last, 50 years, 25 years, they really haven't made any real advancement to actually, reversing this issue. And so we're going to be talking a little bit about that tonight. So cancer is the second leading cause of death in the United States. The second leading cause of death in the United States. So again, and the thing about cancer, it's not selective. You could be a newborn child born with leukemia. You can be a teenager, or you could be someone, that is middle-aged. So it really has no preference, because we live in an environment that is not natural anymore. So the immune system is overwhelmed with not just the atmosphere of toxins in the air, the soil, the water, but also, the terrain of stress, which allows for a lot of opportunistic organisms, parasites, virus, candida, and also cancer. So cancer rates in women, under the age of 50 are 82% higher than those in men. And why would you think that? Well, I think that women carry the brunt of the stress of the family. Oftentimes they're very repressed in their, emotional expression. And so we're going to talk a little bit about that as we move forward. But I think that's probably, would you say, Colleen, it's probably one of the big things that we're looking at, is that they take on the role of the stress of the husband, the stress of the children, the stress of the church, the community. And so oftentimes they don't have a voice. When I work with patients a lot, sometimes they just want to be heard. They just want to have a voice. And so, when we do the therapy, I do biofrequency therapy, where we're, using music therapy and frequency. And sometimes, I might spend 45 minutes just listening to their story. But even just listening to the story is very healing for them, because it's an opportunity to be able to be heard, which I find many patients don't have that, unfortunately, in their homes. So the number of new cancer increases in adults under the age of 50 has increased by 11.7% between 2008 and 2017. So this trend is particular. I'm going to just move this so I can read this a little bit better, bring it down here. This trend is particularly pronounced in certain types of cancer, such as breast, collateral, and melanoma. So Colleen's going to be talking that about a little bit further in regards of options that we are going to be able to share with you today. So here. So potential causes. So we started out, and as a nutritionist, and Colleen would attest to this, because, she grew up in a family where, her mother had to be concerned, in regards of a good lifestyle, whether it was the food, and also the quality of the food. And then, of course, the first thing I look at is looking food as medication, right? We want to get the, what we would consider the seed oils out of the diet, the processed food. That's number one. And then, of course, a good water is essential, because predominantly we're mostly water. And at the same time, the circadian rhythm of sleep cycle, and the rest and digestion, and in terms of what time you should go to bed. And then the phases that happen in terms of the lymphatic system being washed out during, let's see, 10 to 12 o'clock. So we really give you the whole cycles of how the body should function on the circadian rhythm. So you're aware, if you're watching TV or on your cell phone till 1 o'clock in the morning, you're missing some of these natural functions that allow you to stay and be healthy. And then, of course, so many of us, we look at exercise as an option, and really exercise. And I know Colleen's been an avid athlete. She can talk a little bit about her experience as being a top athlete. And with me being a runner, it was just part of a lifestyle for us. And so again, when you have issues like I had, an ACL tear, a ruptured, Achilles tendon. So you have to say, okay, well, exercising, movement is, it's not optional. It's just now I've got to shift from one method to another. So I say exercise is not an option. We just have to say, if I can't do that, what can I do? And, Colleen's been dealing with that with her kind of knee and stuff. And so again, exercise is essential for circulation and also to keep the integrity of your muscles, because when you're ill, especially with something like cancer, it's very, very catabolic in nature. It breaks down lean muscle tissue. When you're under stress, it's going to also break down the lean muscle tissue. You want to talk a little bit about the exposure to toxins? Just in our, like, I think there's how many thousands of toxins are we exposed to?
Oh my God, it's too many to name. And, you've made a lot of good points. You brought up nutrition, sleep, toxins. Of course, there's xenoestrogens everywhere. Pesticides that is a substance that has mutated and changed to look like estrogen to the body and function like estrogen, except it's aberrant. It's not really estrogen. It's called a xenoestrogen. That's seen in BPA and the plastics and pesticides. And not to mention a big one is EMFs.
Absolutely.
You've got to, turn off your circuit breaker at night. Put your telephone on
Airplane mode.
Pull the plug on the modem and get good sleep, because we are surrounded.
We're not gonna get away with not having exposure any way you look at it.
Right.
So we want to be able to protect ourselves, and again, we can use the glasses, the block out the blue light, that causes a lot of overstimulation. So for me, I kind of have a rule: by 9:30, no more TV set, no more cell phone in regards to, looking through your, Instagram, because it's addictive. Your brain just starts going, oh my God, and the next thing you know, you're just like, oh my God, it's an hour later. What time is it? 10:30, 11 o'clock, right? I mean, I can find myself guilty of that, but whenever I do that, I will guarantee you I have more nightmare dreams, right? They're chaotic in nature. So, I always say, okay, now I'm going to read something more spiritual or something that's not too overstimulating or too scientific, because that will be in my mind as I go to sleep. And so again, Colleen was talking about the xenoestrogens and hormonal imbalances. And again, that's something that we are expert at here in regards of balancing hormones. And, hormones isn't just something that you're dealing with when you're, menopausal or you're in testopause for men. We see that now, with all of the microplastics, that, men at the age of, 18 years old are showing testosterone levels of like a 60-year-old man. And we're wondering why, the population, the birth rate is going down.
Infertility problems.
Infertility big time, and even with, young women as well, their lack of, because they're under so much stress that their bodies, still letting the pregnant alone, which is, basically not allowing them to have the progesterone, and then, they can't hold on to the fetus, and a lot of time end up miscarrying. So with our patients that want to have children, we make sure we do check their hormones, and if we have to give them progesterone, we definitely will do it, even if they, are not in a menopausal situation. So all these factors make a huge difference, because we live in an age right now where it is not natural to the body.
We almost don't need estrogen, I've found.
Yeah, right.
Our levels are too high now, and it's not natural. It's from outside perturbances.
Yep, I definitely agree with that. So we're going to talk a little bit about low-dose chemotherapy, and I think for you, this is going to be your expertise. So I'm going to kind of let you take over here, because I do not do any low-dose anything. So I'm going to go ahead and let's go here. So what is low-dose chemotherapy? Okay, and so Colleen, I'm going to go ahead and let you explain that.
Yeah, fractionated chemotherapy is just that. We take, rather than a full dose, 100%, which has, and I know one of the patients asked, or somebody asked a question about this, full dose versus low dose chemotherapy. Full dose is kind of a tsunami hitting the body, hitting all the receptors. Fractionated, as it sounds, is we take a percentage, 10, 20, 25% of the total dose. And, it's rhythmic. We watch the patient when we're not giving the chemotherapy. They're getting other therapies that are actually supporting their immune system. So this metronomic way of giving chemotherapy is much safer. It also doesn't saturate the receptors. What does that mean? Well, If we do 100%, we do 6 times at 100%, which is pretty standard. The receptors get tired, they get saturated, and it doesn't work anymore. And you just burn that bridge. That's done. Fractionated is not the case. We can keep a sensitivity, and if you need another round or other drugs or natural substances that also hit those receptors, will still be active and will still be effective because we're not saturating the receptors.
So in essence, you're kind of saying that, full exposure can create a resistance. And so oftentimes what happens is that if they eradicate the cancer, now let's just say for several years, it oftentimes comes back with a vengeance because the body no
Yes,
longer
it does.
responds. Yeah.
It goes into hibernation, actually, kind of like a bear. It builds itself up, and when it comes back, it can be stronger. Low-dose chemotherapy also targets the circulating tumor cells more effectively. So those are the little guys, I say, that your tumor, the mothership, lets out. They're stem cells. They're looking for another home. They're looking for a place to inhabit because, like any organism, it's just trying to survive. They'll go to the lung. They'll go to the bone marrow, wherever there is blood supply as one aspect of it.
And this is why it's so important to look at food like medicine, because we know that cancer thrives off of glucose. Yeah. And then, of course, it prefers junk food than it does healthy food. And so again, when we're changing the terrain, it's like we're kind of rebuilding so that the seeds that we plant are the seeds that we want to plant so that we don't end up with the weeds again in the garden. So it's essential to look at food as the basic foundation so that all of these therapies work more effectively, because a lot of times, Colleen, would you say we would recommend, fasting prior to, I think it's, what is it, the 72 hours before and then, half of the next day. And, talk a little bit about why we would recommend, them oftentimes, this is something that standard physicians would not do, is to recommend fasting for the low dose chemo.
Oh, well, fasting is part of the fractionated chemotherapy known as IPT, insulin potentiated therapy. And what this is doing is, and again, it's a smarter method of chemotherapy versus the tsunami version at 100%. We're starving the cells. And the patient, just to go through a day, the patient will come in and hopefully they're doing intermittent fasting anyway. They're on a ketogenic diet, low carbs, low sugar. And then we help them block glutamine, because it's glutamine and glucose that are the uptake, the food, the fuel for these organisms. So the patient maybe finishes dinner at 6 o'clock. They don't eat until the next morning. Based on their height and weight and so forth, we calculate how much insulin they should receive that morning. They're instructed, of course, to bring some orange juice, some fruit, and so forth to recover.
To get their glucose levels back up when you drop them down, correct?
Right.
Yeah.
So we give some pre-medications, obviously, that are actually given in the standard of care, and that would be, Benadryl and Zofran and dexamethasone. We give you an antifungal just to make sure it all goes smoothly. You don't feel nauseated. By the way, we have no side effects except for occasional constipation or staying up too late at night that night because the steroids make you kind of excited. And then we're measuring your sugar all along. After the insulin is given, we'll measure a sugar at, say, 40. Normal is around 90 to 100. At 40, you might get a little glistening, you might get a little shaky, might feel a little bit foggy brained. It's at that moment, that beautiful window, we push the chemo. Rather quickly. Most people have a central line. Then we're watching you like a hawk, watching your sugar levels, never let you get too low, like a hawk. Then we say, okay, you're 35, drink your orange juice. Well, what does that mean, just to do all of this so quickly? Those circulating tumor cells, or tumors, depending, have their receptors out like this. They are looking for food, they're looking for fuel, and they're not getting it. And then suddenly, whoosh, they get this orange juice, they get the pineapple, mangoes. But right before that, we gave the chemotherapy, Trojan horse. The horse comes in, they go, yes, we got the sugar. But what they get with that package is the chemotherapy. Therefore, there's no need for 100%. You're getting it directed, targeted to the receptors of the circulating tumor cells that you want to hit. It's brilliant.
It is brilliant. And again, this therapy isn't a new therapy, right? It was actually developed in the 1930s and has been used very successfully. So this isn't anything new. It's just new to people who go to standard of care. So we, again, as an integrative, facility, we're looking outside the box in regards of what we can do to support our patients in every method. It's going to go to the next slide. Okay, it says here, okay, I'll go ahead and let you talk a little bit. The cancer cells have 16 times more insulin receptors, which is
right.
So, yeah, they don't need oxygen. They don't need, a blood supply because they create their own angiogenesis. They just need glucose. So what a brilliant idea in regards of lowering the glucose levels and then drinking that. Because I really wasn't sure quite, I knew we needed to get the blood sugar up, but I love that because they've been already hungry for their sugar.
Right.
And all of a sudden, I love the Trojan horse idea. Want to talk a little bit about this?
Well, I'm glad the slide agrees with what I just said. I'm a little ahead.
Oh yeah, you got the Trojan horse. Okay.
I'm ahead of myself.
Okay.
But that's really the case when we do a specialized custom test with your blood. We use a laboratory called RGCC, sometimes Datar. RGC is from Greece, Datar is from India, and this will actually take your blood and talk about receptors, the genetics on your receptors, the mutation sites, and how many insulin receptors you have, if it's sensitive or not, and they all are. And there are a lot of insulin receptors, so you can see how IPT works very well. And
does it also give you what chemotherapy would be the most effective, the RGDC?
Well, that's a good point. I have found, on average, yes. You'll get a graph with, when you get your test back, there are 4 sections of types of medications, alkylating agents, spindle agents, and so forth. These are all strategies to reach the cancer. Now, both in full dose chemotherapy and low dose chemotherapy, we try to use agents from different sections, right? Different types of chemotherapeutic agents to outsmart the tumor and to surprise it. However, Datar and RGCC are custom to the receptors on your individual tumor, on your circulating tumor stem cells. So that's where it differs from the standard of care.
Yeah. Okay. So this is many integrative physicians report that FCBMR works well for cancers of the. Why don't you talk about this, because this is your deal.
Yes, well, as you can read, the breast, prostate, lung, colon, bladder, uterus, stomach, that covers it pretty well. But sarcomas, lymphomas, melanomas works as well. We have patients who are doing doing well, and some are repeat. They're back again with some of these cancers, but it all is very responsive for the most part, especially if they haven't done many chemotherapy sessions with their doctor and saturated all the receptor sites. And that's why we offer the off-label drugs as well, anti-parasitic drugs and so forth. There are many angles.
And this is why we offer so many modalities for prevention. Now we do Molly's test, which is a cancer screening test, which is a frequency test. So we can detect if the terrain, is, more advantageous for, cancer proliferation and things like that. So I think, a lot of patients come for wellness, and, we do a lot of different testing that would kind of just, for Dr. Kelly or any of the doctors here, is what is the terrain? Is there a susceptibility? Is this, a fertilization for this to happen? So again, many people come to us for the prevention. Dr. Kelly says, prevention is so much easier to treat than the actual condition of itself. So
right.
we're very huge on that. Okay, are there any contraindications of this treatment or anyone who should not consider low dose chemotherapy?
Well, certainly, we look at the person. How old are they? What shape are they in? Are they healthy? Are they debilitated? Are they too delicate? What kind of cancer is it? How far is it spread? Do we have metastases or not? And the aggressivity of it. All of that comes into play. It's a team effort, not only with our team here, but when I'm working with the patient, that patient and I are in on a team. And I can't tell you how important it is to have the terrain. I always tell people this is your farmland, and talk about the terrain just as such, because we also use Lucence and Signatera. We use many things to track how well a person is doing, looking at circulating tumor cells, for example. And I literally have seen graphs where the person is at 0, they're doing great with circulating tumor cells, and then it hits November, December, and they have Thanksgiving, and then they have Christmas.
And the stress and that.
And they're suddenly they go from a 0 level to having circulating tumor cells. Like they've woken the beast. But then I said, well, what happened? Oh, well, it's Thanksgiving, cakes and pies and back to sugar. And I don't want to be Debbie Downer, but it's clear to see that, that's not a good idea.
That's why I did a cookbook, because we have a keto pumpkin pie in there. We've got chocolate mousse in there made with avocado and coconut cream. So again, when I'm talking to my patients and I have such a passion for food, I'm like, oh, it's so beautiful. And they're like, oh my God, we have to have a cookbook. So it took me 3 years to do a cookbook, but I have it out there for our patients. And a lot of them say, this is my Bible. And it has so many different anti-inflammatory herbs. So again, it's for everyone,
I'm going to move in with her. You should see her lunches. I'm like, when do you have time to make all that? It's unbelievable.
It's called self-care, right?
Yes.
So at 68 years old, I'm like, okay, well, I don't need 3 meals a day, but I'll do 2 shakes and a meal oftentimes. So you better believe my lunch is like a 5-star lunch.
It is.
I know. Okay. So I'm going to just check in the chat. I know that there is, do we have a couple of questions underneath this too?
Yeah.
Okay,
we did.
So I think we did this one already. I think that Colleen addressed this already. So how frequently are the treatments administered and when?
Weekly. And in the morning, patients come in, they go through as I described, the insulin potentiated therapy. And then afterwards, they go across the hall and they get the light therapy for about an hour. We try and keep that room a little darker, and because by then you're in a bit of a sugar coma, and everybody takes a nap. And after that, they have red light therapy and they go home after that. So it's once a week, about the first half of the day, and then you get to go home.
What can be done during and after treatment to detoxify from the poisons and recover from the damage to our healthy cells? Your brain, your hair, your bones, strength, balance, white blood cell count, etc. So what do we do to support that?
All right. There's some things that you do during the chemotherapeutic period, and let's say 12 is a pretty common number of weeks that you'll be receiving chemotherapy. During that period, to keep your red blood cells, your hemoglobin, your hematocrit at reasonable levels, I have the patients take papaya leaf. These are capsules they take three times a day. And that's a big dose. When you're not doing chemotherapy, you don't need that. But that's just for a short period of time. A real build will help build the white blood cells a couple of times a week. Also desiccated liver, and your keto diet to help keep the red blood cells where they belong. If people get too anemic, they have too few white blood cells, lymphocytes, neutrophils, so on, they can get into a danger zone. And if it's not healthy for you to have another session, we'll postpone it. Your health is more important than trashing the whole body in the process. That's not what we're about. This is a rhythm. This is a press, pulse, build you up all week, to give you the chemo, build your immune system up all week, give you the chemo.
Okay, I love that. Is it true that chemo can strengthen cancer stem cells, making future tumor activity more likely and more aggressive? How can one reduce the likelihood of tumor reoccurrence if we are weaponizing our cancer stem cells in the present? After they are effective and affordable, therapies available to reduce or eliminate these cancer stem cells.
Oh, I see. Okay.
Are they effective and are they affordable?
Well, weaponizing is a really good term, because when you think about what we've been doing for the last 50 years is a certain group of people at the turn of the century actually invented these chemotherapeutic agents from Agent Orange and petroleum and so forth. So it is weaponized and can be very dangerous. And as I spoke earlier, when you have 100% chemo, you're saturating all the receptors. And there's a very good chance that there's going to be resistance. And then you have to, well, if you're getting 100%, I don't know how you're going to increase that dose. With fractionated chemo, we don't get near that. We can increase from time to time. If I look and see we're not making enough progress with the circulating tumor cells, I might increase from 10% to 15, 20, or 25%. Don't usually go over that. There's no need. We will look at everything. The RGCC test also, and DATAR also give natural remedies, natural substances that are cytotoxic. Mm-hmm. So we have DCA, we have artesunate, we have high-dose vitamin C, we have high-dose curcumin. All of these work as well as chemotherapy. So in the days you're not getting chemotherapy, you're still getting a cytotoxic hit to those circulating tumor cells. And then on the off days, right, instead of doing pro-oxidative therapy, perhaps let's support the body with Meyer's cocktail, but we call it MitoFit. So it's amino acids, plus all the B vitamins, alpha lipoic acid, poly-MVA, good for the liver, full barrage of vitamin B, keeping our immune system intact. That's what it's about. Ultimately, your body has the intelligence, and if we give it the right rhythm, all the body wants to do is come back in balance and homeostasis. We don't need to hammer it, but we do need a pulse and a rhythm to what we do, and each patient has a different rhythm.
Yeah. Okay, so I think there is a couple in the chat, so I'm going to go ahead and look at that. It just says, congratulations, Dr. Galvin. Definitely insulin low-dose chemotherapy, potentiated therapy is the best approach to cancer. I knew the original inventor of the protocol. My grandfather will be happy knowing that as of 2025, you are using his protocol to help patients recover and have a better outcome. Big hug from Donato Perez Garcia, MD. I'm the grandson of the inventor. I loved hearing you talking about my family's medical work.
Wow, thank you.
That's awesome.
Woohoo! All right, I'm gonna call you.
Yeah, a big shout out to Donelo Perez Garcia.
All right.
Okay, and you know, she speaks perfect Spanish because it's great. Because a lot of our patients, you know, they sometimes don't speak English, and so it's wonderful to have a doctor, and Dr. Keneally is fluent in Spanish as well, so be able to communicate, you know, from their mother tongue, which is awesome. How do CTs go from O to more? Is it impossible to completely eradicate CTCs from the body?
Good question. I'll never say impossible. Let's start with that. 0 is what I'm aiming for, and I'm sure what patients would like to hear and see. You know, when we go beyond chemotherapy, the RGCC company offers, for example, 2 different vaccines. One that goes after the circulating tumor cells only, and that's called Q-Restrain. It used to be called an SOT. The other one is a Clavicure, which stimulates your body's own white blood cells, T cell, B cell, natural killer cells, all measurable and so forth. And both of these vaccines come from you, custom to your receptors. They make it, send it back, and we then deliver it to you with an IV. So that's pretty cool. That also helps to lower those CTCs that are maybe resistant, as well as all the other therapies I mentioned. So yeah, it's possible to get it to 0. And then you're going to keep it there, please, with your terrain, your ketogenic diet.
The mindset.
The mind, yes. Yeah.
Want to talk a little about SCP? That's probably something people have not heard about. John's treatment.
I wish John were here to explain exactly how it works. I've used it. I've had him do it to my knee. I'm waiting for my shoulder. It feels like shockwave a little bit.
Kind of a electrical.
A very fast electrical pulse that actually
creates it's the spin.
How does it work actually?
Okay, so basically, you know, I mean, John is the expert at this, but basically cancer cells have a reverse polarity. So what he does is he goes over the body with a specific crystalline, and so healthy cells will go to the left and unhealthy cells will go to the right. So then he takes the SCP, which is a pulse magnetic, and he puts it onto the spots. He goes kind of like, you know, if you were getting a facelift and putting all the little dots all over the place, and then he goes to all the areas that he finds the reverse polarity, and he does it until it goes back into spinning. And in India and places like that, they actually use this as a standalone treatment to treat cancer. So we've got we've got all these really incredible types of treatment that are non-invasive, which is great as well. Because sometimes patients do come here because they don't want chemotherapy. And so we try to do we respect, we honor, you know, and again, you know, we don't like to sugarcoat anything. So at the same time, if we feel and the team feels that, you know, it would be more advantageous, then we try to give them the information and then we let them make the choice. But of course, we would encourage them oftentimes.
You know, we haven't talked at all about oxygen and ozone.
Yeah, talk a little bit about that. I think that's so important since, you know, cancer doesn't like an oxygen-rich environment. Yeah.
Yeah. I mean, just reflecting on the whole of our conversation, and then we can, get to some of these questions. Without a doubt, we talked about what the fuel is. Well, what kills it? And we've recently learned how to use ozonated glycerin. That's so cool, both IV, orally, nebulizing it. And so basically it's ozone that is packed in glycerin. A Japanese veterinarian figured this out, and it's about 30 times stronger than having an ozone treatment here in the clinic. So guess what? You get to take it home in a bottle and then nebulize it and get it systemically, system-wide. So we have ozone treatments. We have hyperbaric, which is going to push oxygen into your cells, and an MAH, major autohemotherapy, or ozone going into your blood with your blood actually mixed and then back in intravenously, oxygenates your whole system and oxygenates and obliterates some of these circulating tumor cells. Underneath that, or as important, what's creating all this? We talked about EMF, we talked about diet, we talked about xenoestrogens, environmental toxins. Well, there's also heavy metals. There's Lyme disease, heavy metals, parasites. We all have candida, which is stimulated by EMFs, believe it or not. I mean, it's just ridiculous. It's an onslaught, and I think that's why we're seeing, I know epigenetically, not genetically, that's only accounts for 5-10% of all cancers. Epigenetically, what our environment is doing to us, we're seeing it now. All of these cancers in patients that are 20 to 50. It used to be,
old age.
You're 80, you had a good run. You're 75, and nobody wants it. Don't get me wrong, but it was never 20-year-olds, never 30-year-olds.
Never children?
It's the epigenetics. And so we measure all that, right? We look to see your viral levels, Lyme, mold, everything, and heavy metals. So in addition to cancer, or if you're cancer-free, you come in because you want to be healthy, we want to eradicate anything that's going to put a damper on your immune system.
Distraction.
And clear it.
Yeah.
So that's why we have, and this is in talking about ozone therapy, EBOO. So that is the full-on change your oil, boy.
Like a dialysis, right?
Yeah, so your blood goes out. It goes through UVB light, which will kill mold. It'll kill viruses. It'll kill the detritus in your blood, bacteria, and so forth. Then it goes through the ozone, which will further kill all of those buggers. Then the most important thing that we have with EBOO is it goes through a dialysis filter so that it will trap anything smaller than 500 nanometers before it then comes in the other side, bright red, whereas it went out kind of purplish. And we can also see evidence of what it's caught in those filters.
Yeah.
And it's just tremendous. So you can do EDTA and clear your heavy metals. You can do phosphatidylcholine and lower the detritus, the plaquing that has occurred in your arteries and your veins. So, yeah, it's complicated, but we have answers.
Okay. So next question is, do you treat patients who have had traditional full dose of chemotherapy and now have a reoccurrence?
Oh, absolutely.
Yeah, absolutely. Dr. Keneally sent an email last week for Breast Cancer Awareness Month. She included a study in which a certain type of iodine was rubbed on the breast. Is this the type of iodine that is sold in the Perfectly Healthy store? Yes. So it's not your mercurochrome iodine that you would use to clean a cut. It's actually one that you can actually ingest. So Yeah, a lot of, I mean, I remember I had a little cyst, and I put iodine on my cyst, I think it was for like 6 weeks, along with progesterone, and it completely went away. My body reabsorbed it. So iodine is something that most of us, we don't have it in our diet anymore, right?
Yeah.
Nobody eats seaweed, and salt is, it's basically doesn't have any real iodine anymore. And
right. And cancers attack the endocrine system, in particular the thyroid.
yeah,
So I always recommend that you can mix the iodine with frankincense, which breaks up stagnation. It's a Chinese herb, actually Indian as well. And mix it with DMSO or castor oil. But DMSO is a cream that we have here that's anti-carcinogenic. You can put that anywhere, in the breasts, on your belly, prostate.
thyroid if you have nodules.
Absolutely.
It said, to add to Veronica's question above, do you treat patients who have started a traditional full dose chemotherapy treatment but don't wish to continue?
That happens frequently, actually.
Yeah.
Yes. Patients do one or two and they just say, I can't do it. I couldn't get up for 5 days straight, and it took me another few
Knocked
weeks.
me out. Yeah.
Yeah.
Yeah. I mean, it just depends on your constitution. My mother had cancer, breast cancer. She went through the whole chemotherapy. My dad had 2 treatments, and it nearly killed him. So we had to get him off and do natural treatment, where we did my mother natural and also traditional treatment as well.
Yeah.
Okay, so let's see here. Is it good to use home coffee temp and red light therapy? How does it work when you give blood plasma to get rid of the heavy metals? With the EBU, or with what? What is this here? Coffee temp. I don't know what that is.
I don't know what that is.
I think it's an at-home red light therapy.
At home red light therapy?
see.
Okay.
Yeah.
It's a little bit nuts.
I hate to say you're going to need, first of all, do a proper evaluation where we give you EDTA, we collect your urine over the next 6 hours. And from that, we take a sampling of it, and we can calculate, the company, thank you, not me, will calculate exactly the type of heavy metal, be that barium or uranium or lead or mercury, and then you really need, in order to get that down, you're going to want to do EDTA IVs, followed by that EBU, which will trap the heavy metals.
Yeah, and someone said that, I heard that when you give blood at the blood bank, it gets rid of heavy metals. So the heavy metals are usually in fat. They mercury affinity to the brain and the fat, and so usually what's circulating in the blood is really not that much in regards of actually down regulating the heavy metals. So we would use we do IV chelation, and then we do oral chelation. So that would be much more effective, much more effective. So I think we're getting close to our time. So I kind of just wanted to add, there's lots of studies now that can support that your unprocessed emotions and repressing and expressing emotions can be a factor in acquiring or getting cancer, because there's studies done with Galvin and women, for example, of in unhealthy marriages or not happy in their marriages, and they both got cancer equally. But then there was those who were able to express and talk to their girlfriends about it and complain and do all this stuff. And then the ones who did not complain and held it all in a repressed emotion, they had definitely a higher incident of cancer, particularly breast cancer and more female type of cancer. Mm. So it's essential to recognize that we all need to be heard. When you were a child, you need the validation to feel safe. You said, look at me 100 million times to your mommy, because you wanted to know that she had eyes on you. And she heard you, felt you, and could console you. And so again, I always tell my patients, you need to be your own mother, your own spiritual advisor, and your own best friend. And so how would you advise your best friend? And so again, having a critical voice and repressing, there's certain emotions that are I call the seeding of the environment for cancer. Being a people pleaser, the need to do for others despite the need to do for yourself. perfectionism, workaholism. Any ism is going to be something that is conducive to it. And so this is something we think, okay, well, we are selfless, we're giving, but not despite with it meeting our own needs is really important. And there's a whole list, in regards to, avoiding conflict and just, not having healthy boundaries and not knowing and not feeling safe to say a healthy, compassionate no. And so, Dr. Vanderkolk, Bethel Vanderkolk has, when the, his book is, oh my God, my brain just went dead on me. It's when it says the body holds the score. So again, when we repress these emotions, your body's still holding it in the tissue. And so it's really important to look at just not your own personal life, but transgenerationally, what has been passed over to you genetically. And then Galvin Mate, when the body says no. So those are two books that, I would highly recommend, one being a psychiatrist, Vanderkolk, and then Dr. Gabor being a medical doctor. And I love him because he's got both of them have a ton of YouTube videos that you absolutely should watch to help you in regards to just, knowing how to downregulate and to be able to recognize when your nervous system is out of sync and you are dysregulated. So, I think I'm going to end with that. And do you have anything else to comment?
Yeah, low dose metronomic oncology isn't about doing less. It's about doing smarter. And I would recommend to people, I was kind of blown away by this. I know Dr. Keneally and I discussed Dr. Soon Shiong, Shiong, from South Africa, the inventor of Abraxane and many other chemotherapeutic agents, was in an interview with Tucker Carlson and stated that actually low-dose chemotherapy, he's pivoted on his original stance on cancer care and thinks that low-dose chemotherapy is the way to go. And he is now doing trials, started with the urinary bladder cancers, to work exclusively now on the immune system. So we see that the trend, and many doctors are moving towards this trend and changing their way of treating. So that's a good thing.
I'm just going to write the doctor's name down because I think they're amazing. I've learned so much from both of them. And again, this is all free information that you can get right off of any of the YouTube.
I know we're about finished. Didn't someone ask about calcifications?
Yes.
Yeah. Do I have a minute?
Yeah, you do.
Calcifications in the breast or anywhere in the body can be an indication of inflammation. My goodness, I could talk for an hour just about inflammation in the body. But residual inflammation in the breast in particular with calcifications, or an insult or an injury, or, it depends on what they look like. And you don't necessarily have to worry about it, except when those calcifications maybe are seen in a tight cluster with an irregular border. Something like that visualized by a trained radiologist. Now that would be more worrisome than just satellites of calcium necessarily. In any case, we need to see you and understand you in particular and your particular needs and cancer if you have it, but your history and your exposures and all of that. And from there, we'll give you the best treatment we can.
So thank you for joining us this evening, and we look forward to sharing with you in a couple of weeks. Have a good night, everyone.
Good night.